following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Every cancer patient is unique, and so is their tumor, and that's why not everyone receives the exact same treatment recommendations.
At American Fork Hospital, there's now a new radiation option available. Mary Nichols explains how it works in tonight's Check Your Health report.
I treat patients who have cancer with radiation therapy.
Not all radiation is the same. There are actually several different ways to give radiation therapy to patients.
Most commonly, patients are treated with a technique called external beam radiation therapy.
This is done by shooting high-powered X-rays from the outside of the body to the tumor inside. But for many patients, it's not the best option.
And that's a less effective way to do it because you have to go through normal tissue to get the radiation dose in.
Instead, they're being treated with brachytherapy.
With brachytherapy, we're actually putting a radioactive source into the patient's tumor.
By targeting the tumor from the inside, brachytherapy causes fewer side effects and is more effective at treating the cancer.
With prostate cancer, for example, we will place needles into the patient's prostate, and that radiation source can be put into those needles.
Not everyone is a candidate, though. This type of treatment can only be used on certain cancers.
Typically, there are things that are fairly close to the surface of the body.
Cancers generally good for brachytherapy include prostate cancer, some breast cancers, gynecologic cancers, and a few others.
We need to have a way to get a radiation source into a person's body temporarily and then take it back out.
Without compromising the chance of getting rid of the cancer, this treatment modality saves patients time, money, and unnecessary side effects.
It's a time factor, it's a money factor, but it's also more effective at sparing the surrounding tissues.
Mary Nichols for Check Your Health.
One other benefit for patients is the amount of time they actually save. For example, instead of receiving radiation every day for, let's say, 8 weeks, they're likely only to have to be treated about 3 times that total with the new therapy.